The consequence of not screening leaves children without their parents and them without a diagnosis. It's hard to believe that it's been over a decade since the National Heart, Lung, Blood Institute pediatric guidelines were endorsed by the American Academy of Pediatrics. These are really practical guidelines. They call for screening children at the age of 2 if they have a family history of cardiovascular disease or a family history of FH. And then they call for universal screening at 9 to 11 and again between 17 and 21.
I feel very passionately about this. Atherosclerosis doesn't just jump out of the box. What has happened, however, is that, again, the American approach to science is if you don't have a randomized clinical outcomes, you don't get the evidence. So the United States Preventive Task Force says you don't need to measure cholesterol in kids. Whereas John Castellan, with a great wealth of experience, they check it in everybody. And if a kid has FH, 6 years old, they start treatment.
One would generally try to start medication for patients with FH very early. The guidelines that I helped to write in our 2018 American Heart Association, American College of Cardiology guidelines say that if someone has a history of FH, that we want to try to get their LDL cholesterol down below 100. And it's rare that one could improve their lifestyle habits sufficiently to try to get LDL cholesterols from the 200 range down to 100. So almost every patient with FH needs to be on at least a statin.
And recent data suggests that only 2 to 22% of children are being screened between 9 and 11. And it's actually non-existent between 2 and 9 years of age.
The Family Heart Foundation has always been a huge advocate for the role of screening and recognizing genetic lipid disorders. They've been advocates to providers, to patients, getting the word out to the lay public. Busy clinicians want to change the world. Like, we all want to see this change on a population level, but it's very challenging. We work mostly one-on-one with patients and make a huge difference on that individual level. But figuring out population approaches and how we can screen better in our health systems, in our communities, how we can come up with innovative solutions is really where the organization is moving, and really exciting new developments are happening.
So if we're really looking to improve equity and diversity and get the right diagnosis, we need to screen everybody in childhood. And so I just ask you to talk to your colleagues, get those kids screened.